We're back to finish this interview. Thank you. All right. So, Abby, I wanted to ask you about your spiritual health.
I'm Jewish and I observe Jewish holidays and traditions.
Okay. And do you belong to a synagogue?
No.
But you.
No, but I celebrate with my family, my friends.
Okay, that's good. All right. What about social support?
I have an incredible network. I have friends that are very close, more than my toes and my fingers.
Well, that's great.
I'm very fortunate.
That's good. What about pets? Do you have any pets at home?
I have an 80-pound golden doodle.
Oh, that's really nice. So it sounds like you have a lot of things that help you with your own health.
Yeah.
Good support system. Okay, let's talk a little bit about safety. Do you own any guns or
2 rifles and 2 guns, and we're trained on them, and they're locked in a safe.
Okay, and let's see, what else? Did you get trained to use the guns? Did you have any formal training for that?
Yes, we wouldn't even have them in the house unless we had it. My husband's retired military, and before we got them, we got the safe, and we made sure that we go out on a regular basis, at least 3 times a year, to practice, to make sure that we're
Practice the
accurate.
skills. Okay. What about driving? Do you use your seatbelts in the car?
Yes. We make sure everybody in the car uses their seatbelts.
Okay, good. And you don't text and drive?
No.
Okay, well, that's good. What about house alarms? Do you do anything for the house to?
We have house alarms and cameras, and just in general, we have something called OPSEC in the military, Operation Security, so we pay attention to our surroundings, people around us. We make sure that no one's following us, there aren't strange people, and if there are, we report them.
Well, that's good. All right. Now we're going to review the systems of the body. I wanted to know, are you having any trouble falling asleep, and what is your sleeping pattern?
I need to sleep between 8 and 10 hours. It's been that way the majority of my life. If I can't do that during the week, I can catch up on the weekends. My husband calls it my superpower.
Well, that's good. I'm glad to hear it. Okay, let's talk about your eyes. Do you use anything?
I use glasses. They're broken right now. I'm waiting for them to come in. I used to be nearsighted, and then probably about 6 years ago became farsighted as well, so I have no line bifocals that are on order. And I have some really old ones that I can use for seeing far. They got tested, but I don't need anything to see close in the house, so that's why I'm not wearing my old stuff.
Okay, so while you're waiting for the others to come in, when you're driving, what do you
I use an older pair.
An older pair. Okay, when was the last time you had an eye exam?
Last week.
Okay, and has your vision changed over the years?
Yeah, it changes. It depends.
Okay. All right, what about your ears, nose, and throat? We did talk already about your nose and ears, but do you have any other additional problems with your nose or ears that we've already talked about?
Every once in a while when I'm sick, my nose is plugged and I have to sleep with my mouth open, so my throat gets sore, but that's obvious.
Yeah, for obvious reasons. What about swallowing? Any trouble with swallowing?
No.
And then, have you been to the dentist recently?
I go to the dentist every 2 months.
Okay, wow, that's good. For the gingivitis?
Gingivitis, mainly to have my teeth cleaned.
Okay. All right. What about heart health? Have you ever had an EKG? Do you know
Yes.
any heart problems?
I had an EKG. I had a really painful Cooper's ligament, which is under my left breast, and it hurt really bad. I thought I was having a heart attack because that's how sharp the pain was. So we went to the ER and they did a EKG, and it was totally normal, and we figured out it was the Cooper's ligament. And every year I have one that checks.
Okay, when was the last time you had, during that time when you had the Cooper's ligament pain, when was that?
Oh my God, that was like 20 years ago.
Okay, 20 years ago. Okay, and since then you've never had any kind of chest pain or any
Other than the Cooper's ligament, no.
Okay. All right, what about your lungs? Coughing, wheeziness, shortness of breath?
Don't have that problem.
Okay. Have you ever had a chest cold to where you needed an inhaler or anything like that?
Nope.
Okay, well, that's good. Okay, what about GI? Nausea, vomiting?
I've only thrown up 4 times in my entire life. I have like an iron stomach. So I might feel a little queasy, but I don't throw up easily. There are times where I've been ill, or I've had 2 cases of food poisoning. One I didn't throw up at all, the other one I did. And that's one of the 4 times.
Okay, so how long ago was the last time?
91.
Okay, so it's been a while. What about gallbladder problems, kidney stones, gallbladder stones, anything like that?
None.
Okay. And then your bowel movements, what's your pattern?
1 to 2 times a day.
1 to 2 times a day?
Pretty much I eat and I go.
Because you have fiber, you were telling me that you've got a good intake of fiber. Okay, so no problems in that area then. All right, what about your last menstrual period?
February 3 years ago, 2016, around my birthday was the
Okay.
last period.
Last period, so have you had any symptoms since, any like hot flashes, migraines or headaches or anything like that?
I don't like coffee, obviously, because I'm allergic to it. I found out later. And when I'm ovulating, it makes me a little nauseous.
Mm-hmm.
And I still am ovulating a little bit because that still happens, but it's not as severe.
Okay. All right, what about any vaginal discharge?
Nope.
Okay, and have you had pap smears, right?
February 18th.
That's the last one?
Yeah, 2019.
Was it negative?
Yep.
Have you ever had any positive pap smears?
Once, like 30 years ago, and they just did another one and kept up with it and found out it was false
Okay,
positive.
all right, and then have you ever had any problems with your uterus or
Nope.
fibroids or anything
Nope.
like that? Okay. All right, what about your muscles? Have you ever had any problems with balance, weakness in the
Nope.
muscles, or
Nope.
cramping or
Nope.
things like that? Okay.
I do have cramping from time to time. I'll have a Charlie horse.
Okay, and that's
Just from drinking so much fluids and my electrolytes being low.
okay. I see. All right. What about skin? Do you have any rashes or any kind of skin issues?
No, I go to the dermatologist once a year as well. And they checked and everything is fine. It's very typical. And then I have a massage every 2 weeks, and my massage therapist checks as well.
Well, that's good. What about your breast? Have you ever noticed any irregularities in your breasts?
Nope, and I do the testing every single month. And then I have a breast exam or a mammogram, which I did. I had a 3D mammogram, and everything is fine.
When was the last one you had?
It was at the end of February this year.
So February was your wellness month? That's good. And it came back, did it come back negative?
Yes.
Okay, good. I'm glad you're doing that and you're doing self-exams. Okay, neurological stuff like headaches, migraines.
I get headaches, but we're good.
What about sensation like tingling, numbness, or pain in your hands or feet?
No.
Okay. Any depression or anxiety? Anything like that that you've experienced?
There were 18 people that died over a period of 22 months, and I was depressed during that time.
How long ago was that?
5 years ago.
Okay. And what did you do for that? Did you get any
Cry.
no treatment? You grieved, but you didn't have to have any medication for it.
That's correct.
Okay. And how are you feeling now? Regarding
Much
that?
better.
Much
Not
better.
depressed at all.
Okay. What about labs? When you've had blood work drawn, have you ever been told that you're anemic or that you have any kind of
No.
hematological issues?
Nope.
Okay. And your hormones, progesterone, estrogen, any imbalances in there?
Nope.
Okay.
I can't believe that I'm in menopause and I'm not having any issues.
Right, that's what I was wondering.
Don't have hot flashes. I'm not losing any hair.
Mhm.
I don't have any problem lubrication during sex. None of that
Okay,
stuff.
okay. What about, have you ever been told that you're pre-diabetic or diabetic? Okay. All right, and we did discuss some of your allergies that you told me about, you know, the sulfa, the, what was the other one?
Lisinopril.
The Lisinopril, yeah, okay, reactions. So we covered that. And then immunological, have you ever been told about any type of reaction, like autoimmune disease or
Nope.
anything like that? Okay, well, I think we're done. If I forgot to cover something, I'll catch you on the next visit, but I thank you for your time.
Thank
And
you.
we'll go over some of these things after we get some tests done, okay?
Okay.
Thank you.